локальне медіа може змінювати життя молоді?
Media about Western Donbass. How can local media change the lives of young people in a frontline city? In the spring of 2026, the STEP team Media About Western Donbass launched the project Youth Here, Generation of Recovery. It is today's youth who will rebuild the country, and our task right now is to give them these opportunities. We started with the basics. We asked young people what they were missing. We conducted a survey and found that the problem is a lack of spaces for development and leisure. But as we worked on the project, something unexpected came to light. Such spaces do exist in the city. They're just not well known. We told people about these youth spaces, and it worked. After our article, new participants joined the hubs. More to come. We brought together young people, government officials, and the public for an open dialogue meeting. Together, they discussed problems and sought solutions. The lack of a youth center, the scarcity of events, low awareness, results, concrete ideas, new contacts, and even preliminary agreements on creating a youth space in the city. That's why we held a training session on starting a career. No fluff, just practical tools. The young people were able to talk directly with employers, learn about internships, training, and even grants for starting their own businesses. We also took it a step further and organized a job trial. For one day, the teens became employees at a bakery and a laundry. What was the result? Young people began to trust the media more, get more actively involved in events, and most importantly, see a future in their city. For us, as a media outlet, this is also growth. More subscribers, more views, and most importantly, a real connection with the audience.
Тисячі людей змушені починати життя з нуля у нових містах і громадах.
Thousands of people are forced to start their lives from scratch in new cities and communities. But along with finding a home comes another question: where to find work and how to settle into a new place. We decided to help internally displaced people in the Kopinchinsy community with this problem. To help address this issue, the film crew traveled to Kopinchinsy, spoke with local authorities and businesses. In addition, the editorial team hosted a talk show that brought together all stakeholders, businesses, government officials, and IDPs. There were 20 participants in total. During the talk show, they discussed employment opportunities for IDPs in the Kopinchinsy community, both online and offline. Additionally, IDPs who had settled in the Kuternitsy region shared their success stories of starting their own businesses. Furthermore, local authorities in the Kopinchinsy community agreed to collaborate with a businesswoman from Ternopil who had relocated from the Kherson region. Moreover, 12 of the 15 IDPs surveyed after the talk show said they were considering applying for a grant and starting their own business. Overall, the This Is My Home project has served as a catalyst for IDP employment, collaboration, new ideas, and mutual inspiration.
Перебування у лікарні – це завжди непросто.
A hospital stay is never easy. For many people, it brings stress, anxiety, and a sense of isolation. That is why the editorial team at Zofti Wadi City launched and successfully implemented a project aimed at making the hospital environment more humane, welcoming, and open to the community. We identified a problem. Patients lacked opportunities for psychological relief. To find a solution, on March 19, we organized a large offline discussion together with the nonprofit organization Volon Center. After the first meeting, it became clear that the desire to act was there, but experience was needed. So we organized a second discussion, online, with specialists from Ukraine's leading hospitals. We were joined by experts from Akhmedit, Art Studios, and the Association of Hospital Clowns. Our medical staff and volunteers received practical advice on how to work with children of different ages, how to organize a safe space, and how to make therapy truly effective. The next step was to establish a sustainable system of cooperation.
We signed a memorandum of understanding with the Center for Primary Healthcare, which allowed us to officially organize events, coordinate schedules, and ensure the safety of our volunteers. Together, we formed a team of volunteers and began setting up bookshelves in the hospital. We launched a book drive among community residents. Residents, book clubs, and partners from other cities joined the initiative. Throughout the project, we not only took action, but also explained to the community why this was necessary.
Posting videos and participant stories helped change perceptions of the hospital as an open space where not only medicine, but also humanity matters. Most importantly, we received sincere feedback from patients who felt calm, supported, and emotionally relieved after the meetings. Today, we can say that local media can be more than just a source of news.